Hey, it's estimated 50 million men suffer from some level of hair loss, and 35 million women are affected by thinning hair as well.
And with August being National Hair Loss Awareness Month, we want to learn more about the causes and the solutions for this. So joining us live in studio to talk more about it is Dr. Richard Chaffoo, who also wrote a book on the topic. Dr. Chaffoo, thank you for joining us today.
My pleasure. Good to see you.
You literally wrote the book.
You wrote the book.
Big book, right?
Yeah, well, talk about hair loss, what it
Sure.
is, and obviously when are people most affected by it?
Of course. So, hair loss can occur really at any age, and we know that, as you said earlier in the lead-in, that it's something that affects tens of millions of both men and women. The most common cause of hair loss is what we call androgenic, or AGA, hair loss for short. Occurs, 40% of men at the age of 40, 50% of men at the age of 50, and so on and so forth. And in women, it's estimated at least 40% of women will suffer from androgenic hair loss. The first sign can be excess shedding of hair. So you might notice we normally will shed about 50 to 100 hairs a day, in the shower, in our brush, our comb. But this seems to be an accelerated process. And one of the first things that people don't realize with hair loss is we need to lose a lot of hair before we begin to see hair loss. So we're born with about 100,000 to 150,000 hair follicles on our head, and unfortunately we don't regenerate those. We don't grow any more of those. They continue to cycle throughout our lifetime. And we have to lose almost 50% of the hair in that one area before we begin to notice thinning of the hair, which is obviously a large number of hair.
Wow. So are there specific symptoms we should look for, just like once you start to recognize it, it's time to take action?
It's time to take action. You can see that in other causes. There are two main categories for hair loss. There's what's called the non-scarring alopecia, or the androgenic is most common, and then scarring alopecia. So scarring alopecia is more associated with autoimmune type disorders. So oftentimes people will have some other problem going on affecting somewhere else in their immune system. They may have swelling of their joints or aching or other symptoms, but oftentimes there are really no symptoms other than you just begin to notice a receding of your hairline getting thin, losing hair in the crown, which is harder to see because we don't look in the back of our head very often.
Are there any risk factors that are involved for certain people, or what are the causes, the main causes?
Sure. So the main causes are really quite wide. We saw in COVID, people were losing their hair because of the stress. We know any kind of stress you have, any major crisis that you would have in your life, the stress of surgery, can be related to different medications that people take. So we always want to get a really good history. Can be related to an endocrine or thyroid disorder. Can be related to obvious things like if you've had prior chemotherapy or prior radiation therapy. Those can certainly affect hair loss. And then the most common being that progressive hair loss that we see in men and women.
So when we tell our kids, you're stressing me out, and this is the reason,
it's
this
very
is the fact.
possible, man.
We're not lying.
Exactly.
What can we do to prevent it? And is regrowth, what's the best way to treat it? Let's just go with that. What do you do about
so the most important thing, Andrew, is recognizing that you're losing the hair, getting in to see your dermatologist, very early on. So there are medications that are very effective in certain types of hair loss for arresting it and then seeing some regrowth of your hair. And then ruling out any other medical causes that are responsible for it. Are you taking medications that are causing hair loss? Have you recently had a stressful event? Have you had surgery recently? All those are possible relating factors.
I remember you were in not that long ago, we were talking about something you take regularly, a lot of guys take regularly.
Yeah, so minoxidil is one, finasteride, used to be called Propecia. Those are really very effective drugs. They're science-based. They work really well in men, and they're medications we can use in women with certain precautions. You don't use typically finasteride in a premenopausal woman, but then there are other treatments that you can do. There are supplements, PRP, which most people know is an injectable material, light therapies. The reason that we put this book together is because my wife, who's a dermatologist, and I figured there was not really a very good book that was like the Cliff Notes that talks about, what are the myths and what are the facts of hair loss and what can you do about it. So it's a real short read, a lot of pictures, very basic, non-science, hopefully not too boring, that can give people a guideline in terms of what you can do to, number one, diagnose your hair loss, and then most importantly, treat it.
Hair Loss Solutions, the ultimate guide to restoring your hairline.
And where do we get it?
You can get it on Amazon.
Okay.
Or in our practice.
And see a professional once you start noticing it.
Exactly.
Thanks, Dr. Chaffoo.
You could see it.
All right. Thank you, Dr. Chaffoo.